Chairpersons, everyone, good morning. And it's my honor to present the effect of intensive blood pressure lowering on retinal microvasculature. That's the most recent results from ASPIRATE trial. We know that retinal microvasculature is a unique and accessible window to human microcirculation. Retina shares anatomical and physiological similarities with other critical organs such as brain and kidney. Retinal microvasculature can be non-invisively assessed by color fundus photography. The color fundus photography image can also be precisely and objectively analyzed by AI technique so that the retinal microvasculature abnormalities can be quantified. Retinal microvasculature abnormalities reflect vascular damage resulting from various risk factors such as hypertension, diabetes, obesity, or dyslipidemia. So they are promising biomarkers that can be routinely monitored for chronic disease. We have already known that hypertension results in various retinal microvasculature abnormalities, such as generalized or focal arteriolar narrowing or anteriolar rarefaction. Small trials have suggested that antihypertensive treatment reverses some retinal microvasculature abnormalities, but we don't know whether targeting systolic blood pressure less than 120 can further generate benefit on retinal microvasculature compared with targeting systolic blood pressure below 140. The main results of ASPIRATE trial has been published last year, and we show that the intensive blood pressure lowering treatment targeting systolic blood pressure below 120 can produce beneficial effects, can prevent more major vascular events compared with targeting systolic blood pressure below 140. So the ASPIRATE trial is a multi-center, open-label, randomized controlled trial. We included more than 11,000 Chinese hypertensive patients with high cardiovascular risk, and the patients were randomized to intensive treatment or standard treatment at a 1-to-1 ratio, and the median follow-up was 3.4 years. So we also pre-specified a secondary analysis of in ASPIRATE trial in a subpopulation. So the primary hypothesis of the sub-study is that participants randomized to intensive treatment targeting systolic blood pressure below 120 would experience a favorable outcome in retinal arteriolar caliber than those in the standard treatment targeting systolic blood pressure below 140. We also want to do some exploratory assessment on other retinal microvasculature measures, including vessel complexity, vessel density, and vessel tortuosity. So we used 4 categories of markers as our outcome measures. The main outcome is the AVR, the arterial venue ratio, which reflects the arteriolar caliber, and also we measured other markers about vascular density, complexity, and tortuosity. So there were 17 sites were included in this sub-study, and they were capable of conducting color fundus photography examination, and also they agreed to participate in the sub-study. All participants from these 17 sites were invited to undergo a color fundus photography examination, and they need to send additional informed consent for this examination. We excluded patients who cannot provide clear image due to eye disease or the systemic disease, or they could not, they were not able to cooperate with the photography procedure. Totally, there were 2,500 participants from the 17 sites were randomized, and finally, 1,200 patients underwent color fundus photography. Among them, more than 1,000 participants provided more than one qualified image that can be analyzed. So they were included for the analysis. That's a baseline characteristics of these participants, and we can see that except age and sex, other characteristics were well balanced, and the average age of the participants were 33 years, and nearly 40 were female, and nearly 40 had diabetes, and 1/5 had coronary heart disease, 1/5 had history of stroke. So the baseline systolic blood pressure was about 146, and then we give them good management of hypertension for 3 years, and then we took the color fundus photography. So during the follow-up, we can see that the standard treatment, the patients among standard treatment arms maintain their blood pressure at about 135, and in the intensive treatment arm, they maintain the average systolic blood pressure of about 120. So we use the rigorous quality control to make sure we can obtain high quality color fundus photography image. We had standardized the hardware and the protocol, and we had certified operators and 3-tier quality control measures. So the color fundus photography examination was led by the ophthalmic epidemiology team from Beijing Tongren Hospital, led by Professor Qing Zhang. She's also here, and Dr. Zhibao Zhang. So that's a picture to show the patients to receive the examination. We use the AI technique to analyze the image of color fundus photography. Automated segmentation and the quantification of retinal vascular network can be analyzed by mature AI technique. The system is a retinal-based microvascular health assessment. It's developed by Professor Mingguang He and Dr. Danli Shi, and has been well validated in numerous public data sites. Using that technique, we can obtain deepening phenotyping of the microvascular structure using multi-dimensional measurement. We primarily analyze the right eye images. If unqualified, we make imputation with left eye ones. The measurement outliers were excluded. For participants with more than one qualified images, we use the mean value. Since the age, baseline age and sex were not balanced, we adjusted these as confounders. We also did subgroup analysis about age, sex, diabetes, coronary heart disease, stroke, SBP level, hypertension duration, etc. We can see we were glad to see the beneficial effects of intensive blood pressure lowering on caliber measures. The AVR was increased, and the CRE, that's arteriolar caliber, also increased, but no effect on venular caliber. So the picture shows that the individual distribution of individual caliber measures. The pink color represent patients in intensive arm, and the blue represent patients in standard arm. And so we can see more patients experience the beneficial effects in the intensive arm. All subgroup analyses showed consistent beneficial effects on the AVR. When we look at other measurements, we found the consistent beneficial effects on the arteriolar measures, not only caliber, but also density, complexity, and tortuosity, but no effects on venular measures. So we also did some sensitivity analysis to test whether our findings were robust, and we got consistent results when we accounted for confounding and center effects, and we also assessed the potential influence of excluded samples due to either poor image quality or participant opt-out, and the results were also similar. And we also tried to include images from both eyes and also got the consistent results. So the narrowed arteriolar caliber is an indicator of microvascular damage or dysfunction, and the improvement in AVR we observed in ESPRIT trial indicated reversal of narrowed arteriolar caliber, which mirror the systemic and persistent beneficial changes in vascular remodeling from sustained intensive BP lowering. Deviations in geometrical architecture such as complexity, density, and tortuosity are also associated with increased risk of vascular damage. And we first demonstrate the favorable changes in the geometrical microvasculature architecture that suggests the improvement in endothelial function, collateral microcirculation, and autoregulation. So our findings have important clinical implications. Intensive blood pressure lowering treatment improves systolic microcirculation and mitigates hypertension-mediated organ damage, aligning with the observed reduction in the risk of major cardiovascular events. Since the benefit on retinal microvasculature can be detected by a simple examination, it can be potentially motivate patients to make risk-reducing changes and overcome physician inertia in achieving an intensive systolic blood pressure target. So what's the implications of our finding for future research? Retinal microvascular measures easily obtained from color funders, photography, and programs hold promises as biomarkers to assess and monitor responses to hypertension and cardiovascular risk management. Effects of intensive blood pressure lowering treatment on other systemic diseases are worthy of investigation. It remains to be determined whether intensive treatment prevents or reverses hypertensive retinopathy and other hypertension-related ocular diseases. So the conclusions are, we demonstrated for the first time that intensive treatment targeting systolic blood pressure below 120 for 3 years improved retinal microvasculature among hypertensive patients with high cardiovascular risk, including caliber, density, complexity, and tortuosity. No heterogeneous effects on arteriolar caliber across subgroups. The effects on venular system were less evident. So the results has been published in JACC just simultaneously. I think this morning. You can scan the code to get a free full text of the paper. At the end of my presentation, I would like to acknowledge experts in ophthalmology and AI technique, Professor Mingguang He from the Hong Kong Polytechnic University, Professor Qing Zhang from Tongren Hospital, and Dr. Dan Li Shi from Hong Kong PolyU. We also would like to acknowledge the research team from Fuwai Hospital, Beijing Tongren Hospital, and the Hong Kong PolyU, and the local investigators, all participants, and funding agencies. Thank you.